Phải tin mẹ.
Sorry, aduh. Assalamualaikum and good morning to all. I am Fatin Kamarina as your moderator today. Today we'll be talking about disability, discrimination, harassment, manufacturing, and how to live quietly. Discrimination, harassment, and work are serious issues that can have a significant impact on individuals, and they will be. It is important to create a safe and inclusive work environment, especially manufacturing, where everyone feels respect and valued. If you experience discrimination or harassment at factory, it is a curious to report it to your supervisor, HR department, or any designated authority within your organization. Before we go, let me introduce our first panel, Dr. Afiq from eye specialist. Then our second panel today is Miss Anis from HR Student Hadis Nemahat. Our third panel is our counselor, Miss Anis. Last but not least, we bring you a victim of disability discrimination harassment to tell her experience, and our victim is Miss Alita. Without wasting your time, let's hear Miss Lalita experience about disability discrimination harassment in manufacturing. Miss Lalita, can you share with us your experience of disability discrimination harassment in your factory?
Yes, of course. Good morning and salam sejahtera. My name is Lalita from Vietnam. I want to share about how I was bullied because of my disability. I was always bullied by others about my eyes. This is because I have an optical problems. I had an experience of being bullied that made me mentally distraught. For example, is I was talking with you, but my eyes were looking to the orthoswap. So some people who already know I have these problems that they stay on that. Sometimes they say, talking with you. Why you are not looking at me? Besides, my eyes also have a hard time to focus on small things. So they always say this to me. Sorry. Say this to
Say
me.
this to me.
Um,
Um,
why are you
why
so
are you
close
so close
to your
to
phone?
your phone?
As if
As
you
if you
want to
want
enter
to
the phone
enter the phone
and
and
uh, and there are
and there
also
are also
those
those
who like
who
to
like
make
to make
road jokes
good jokes
that
that
hurt
that, that
people
hurt
hearts,
people hearts,
pointing a
wanting
wise,
a why,
saying to me,
saying to me,
uh,
uh,
"You are blind.
you are really,
You are blind.
you are really.
If
If
people point
people want
at something,
at something,
do you
do
see
you
it?"
see it?
So
So,
things like
things
this,
like this,
if for others
if
is
just is
seems
seems
trivial,
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 but for me it's
but
not,
for me it's not,
because
because
I think
I
it
think
is
it is
a
a
severe
severe
deficiency for me.
deficiency for me.
It's all for
It's
me.
all for me. That sounds so
Sounds
terrible.
so
Have you
terrible.
reported
Have
this
you reported
issue
this
to HR?
issue to
And then
HR?
can you
And then
share
can
a
you
little
share a
chronology
little
of
chronology
how you
of
found
how
out
you
your
found
heart
out
is
your heart is
with a stick in a
with a stick
problem?
in a problem?
Okay, sorry.
So
My
then,
laptop
my laptop
battery is low.
battery is low.
Okay,
Okay,
I
I
continue.
continue.
Um,
Um,
yes,
yes,
I have
I have
already
already
made a
made a
complaint
complaint
to
to
the
the
relevant
relevant
authorities.
authorities.
I only
I only
noticed these
noticed these
eyes problems
eye
from
problems from
primary school
primary
when
school
I was
when I
in
was in
second grade,
second grade,
where the
where the
teacher
teacher
always
always
reprimand
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 me for
me
writing
for
mistakes
writing
in
mistakes in
Chinese.
Chinese.
Um, at
Um,
that
at
time,
that time,
I
I
remember
remember
that I
that
was
I
just
was just
normal
normal
myopia.
myopia.
So
So
I use spec.
I was back
After
after
after I
after
entered
I
the
entered
third
the
grade,
third grade.
the
The
situation was
situation
stay
was
the
still
same.
the same.
So
So
I decided
I
to go to
decided to go
the
to
clinic,
the clinic,
and then the
and then
clinic
the
transfer
clinic
me to
transferred
the
me to the
hospital to check
hospital to check
what the
what
problem
the
was.
problem was.
From the
From the
specialist,
specialist,
found out that
found
there
out
is
that there is
an optic nerve
optic nerve
problems,
problems,
and
and
this case
this
is the
is the
my case
my case
is the first
is the
one
first
in
one
Malaysia.
in Malaysia.
In the first case
In
lah,
the
first
first
case
case,
in
first
Malaysia,
case in Malaysia.
and a case
And case
like this
like
need
this
to get
need to get
an OKU
an
card.
OTP card. I see.
I see.
I was
I was
sorry. As we heard, it was very challenging because at that time Miss Alita was still in the primary school. So it is a new challenge for her in the learning, but she is a very energetic because she is still continuing her study. So let's move to our first panel. Can you share with us the step taken by your company to address this issue? Let's hear from our HR to their energy. Miss Anis Ayumi. Sorry, Miss Anis.
Thank you to our moderator today. Assalamualaikum and good morning everyone. I'm Nur Anis binti Muhammad Romzi, HR Surya Energy. This kind of problem in common in factories. In this case, I as HR at the workplace, Miss Lalita, have taken action against what happened to the victim. But this, I am only telling in general about the actions that should be taken because there are some difficult things that cannot be explained here. Among the actions that our company can take is to issue a letter to attend a face-to-face call to discuss what happened to him and the victim. In addition, counseling sessions by supervisors are held for employees who behave as stated. If this kind of problem occurs after counseling, then our party will issue a warning letter in the form of the first, second, and third warning. The first warning is usually issued as a warning for misconduct or performance. This warning also needs to be signed and verified by the employee. This is followed by a second warning if the first warning does not as intended. This second warning will be confirmed by holding a meeting with the superiors or the employees demerits for discipline will be imposed. In addition, the employee will be stripped of his position if he has a position in the company. If the employee does not complete the first and second warning, will continue with the last warning, which is the third warning. This warning is the last step in which the employee can be fired. In this case, employees who have received the final warning letter, they can make a letter of affair but must follow the procedures established in the company. So, that's from me, the HR representative.
Thank you for sharing, Miss sorry. Thank you for sharing with us. So here we can also give a warning to the workers who have a committed feeling misconduct in the work environment. Whenever people overworking the factory, okay, let's continue with our second panel. Let's hear from our ophthalmologist, Dr. Afif. Can you tell us more about the myopic eyes problem and how it can affect someone's work?
Thank you to the for today. Assalamualaikum. My name is Dr. Afiq. In the medical field, the term optical typically refers to the eyes and vision. Optical classification in medical refers to the classification of disease, condition, and disorders related to the eyes and vision. Meanwhile, I am the optometrist for this forum. Optometrists and ophthalmologists are healthcare professionals who specialize in optical classification and are trained to diagnose and treat the wide range of eye and vision problems. In Mistress Lalita's case, there are two conditions that happens to her eyes. First is when, at the slide, she is the optic nerve there dekat saraf optik tu you can see the normal optic nerve is straight, but in Mistress Lalita case, next slide. Next. Okay. This is Mistress Lalita optic nerve, where you can see it's a little bit curved at the in the circle. So, Mistress Lalita optic nerve is kind of different with the normal optic nerve should be. So, the first condition that happens to Mistress Lalita eye is she has the problem to focus because her pupils is not focusing the vision that she want to see. Secondly, this rare condition that happens in medical where the optical nerve have the disorder and it also hurt Mistress Lalita focus while listening too long. Overall, the first problem is a condition where her pupils is too near with her iris that affects her visioning. For this condition, it can be corrected by with refractive surgery. For the second condition, this type of disorders are rarely happens where her optic nerve have a condition that different with normal optic nerves. For this condition, there is still no medical treatment that can help Mistress Lalita because it involves optical nerve, which is the very sensitive part in our eyes. Some effects and symptoms will occur and become an issue for Mistress Lalita in everyday life and eventually become a challenge if she does the course. Optic nerve and pupillary block are two separate conditions that can cause different symptoms and effects. For now, Mistress Lalita can use glasses which can help her to focus better. Her vision will be a little brighter. However, she still won't see clearly. In addition, Mistress Lalita also cannot focus on something for a long time because it will cause nerve pain. So, Mistress Lalita also cannot see small things too far. If they are close to the eye, then she can see. That's all from me. I give it back to the moderator.
Thank you for your explanation. Here we know a little bit about rare optic nerve problem in the Malaysia. Indirectly, we can also spread awareness about this to the public so that people know about how this optic nerve problem in Malaysia. Let's continue with last panel, which is our counselor, Miss Angelini. Miss, can you explain Miss the effect on the victim if she hide the problem for a long time?
Yes, sure. I am Anis Aini, a counselor psychologist at Sultanah Raya Hospital. I am involved in assessing, diagnosing, and treating behavior dysfunction resulting from or related to patient physical and mental health. In the US, research showed that 37% or 54 million workers are bullied in the office or repeatedly abused, and this affects their mental health. Back to the question, with this research, it has been able to prove that victims will get threatened and affect every time they are bullied. When
When
employees are
employees
bullied,
are
they
bullied,
are no
they
longer
are no
happy at
longer
work
happy at
and
work
consider
and consider
changing jobs.
changing jobs.
Although the
Although the
employees remain
employees
with the
remain
company,
with the
they
company,
are not
they are not
motivated to
motivated
work
to
at the
work at
same
the
level
same
of
level of
productivity and
productivity,
may try to
and they
avoid
try to
coming
avoid
to the
coming to
workplace
the
as
workplace
often
as
as
often
possible.
as possible.
In addition,
In
if
addition,
the
if
victim
the
does not
victim does
dare
not
to make a
dare to make
complaint
a
about
complaint
what
about
happened
what
because
happened
the
because
bully
the bully
has given
has
treats
given
or
treats
so
or
on.
so on.
Victim who
Victim
always
who
keep
always
quiet
keep quiet
will always
will
feel
always feel
uncomfortable at work.
uncomfortable at work.
He feels that
Feel that
he does not
he does
deserve
not
to live
deserve
on
to live on
this earth.
this earth.
Sorry.
Sorry.
When the victim
The
feel
victim
that
feels
way,
that way.
this has
This
invite
has involved
practices such
practices
as
such as
diversion and so
diversion
on.
and so on.
As
And
in Mrs.
in
Lalita's
Mrs.
case,
Lalita's case,
after she filed
after
a
she filed
complaint,
a
she
complaint,
also had
she
to
also
meet
had to
with a
meet with
counselor
a
to
counselor
express
to
her
express
feeling
her
on the
feeling
matter.
on the matter.
In this
In
case
this
of
case of
disability
disability
discrimination
discrimination
harassment,
harassment,
sometimes a
sometimes
person
a
will
person
feel
will
sad
feel
and
sad
worse.
and worse.
She feels
She
that
feels that
that her
that her
presence
presence
in the world
in
is
the
not
world is not
good for everyone.
good for everyone.
She also
She
feels
also
unhappy
feel unhappy
in whatever
in
work is
whatever
done.
work is done.
In addition,
In
she
addition,
will
she
also
will also
often blame her
often
birth
blame her
on their
birth
worth
on their
and
work
will always
and
hate
will
her
always
stuff.
hate her stuff.
In general,
In
it can
general,
be
it
said that
can be said
she
that
will
she
only
will
think
only think
negatively
negatively
because of her
because of her
disability.
disability.
Thank you.
Thank you. Thank Thank
Thank
you
you.
for your
Thank
detailed
you for your detailed
explanation, Miss.
explanation,
Now
Miss.
we know
Now we
what
know
the
what
victor
the
feels.
victor
I have
feels.
a
I have
additional
an
question
additional
for
question for
Miss
Miss
Amy.
Amy.
The question
The
is,
question
when
is,
someone is
when
bullied,
someone
of
is
course
bullied,
the
of course
person
the person
will experience
will
trauma.
experience
So,
trauma.
Miss,
So,
do
Miss,
you
do
some
you
general
some
tips
general
for
tips
dealing
for
with a
dealing
trauma
with a
that
trauma
Miss can
that
share?
Miss can share? Thanks for the
Thanks for
question.
the question.
Well, I will
Well,
share
I
a
will
little
share
bit,
a
and the
little bit,
rest
and
the
the rest
victim
the
needs to see
victim
a
needs to see
counselor.
a counselor.
There are four
There are
levels
four levels
of
of
recovery,
recovery,
starting with
starting
one,
with one,
awareness of the
awareness of
effects
the
of the
effects of
trauma,
the trauma,
second, followed
second,
by a
followed by
minimal
a
level of
minimal level
functioning,
of functioning,
and followed
and
by
followed by
acceptance and
acceptance and
redirection.
redirection.
Research show
Research
that
show
most
that
people
most
are
people
able to
are
bounce
able
back
to
from
bounce
a
back from a
tragedy. It
tragedy.
is normal
It is
for a
normal
person
for
to
a person who
experience stress
experiences
after a
stress after a
disaster,
disaster,
after
but
a few
after
months,
a
the
few months,
person
the
is
person
able
is
to
able
function
to
as
function
usual.
as usual.
Okay, these
Okay,
are
these
among
are
the tips
among the
for
things
dealing
for
with trauma.
dealing
We
with
have
trauma. We have
7 tips.
7 tips.
Okay, first,
First,
give time to
give
adapt.
time to adapt.
Second,
Second,
get help from
get help
someone
from someone
who cares and
who can
understand the
understand the
situation you are
situation you
facing.
are facing.
Third,
Third,
express your
express
feeling.
your feeling.
Fourth,
Fourth,
get help
get
from a
help from
support
the support
lead by trained
lead by
expert.
trained expert.
Fifth,
Fifth,
practice a
practice
healthy
a
lifestyle.
healthy lifestyle.
Six, maintain
Six,
and
maintain
improve
and
daily
improve
routine.
daily
And
routine.
lastly,
And then lastly,
avoid making
avoid
big
making
decisions.
big decisions.
That's all.
That's all.
Thank you for your
Thank you for
kindly
your
response.
kindly
We
response.
are running
We
low,
are running
sorry,
out
we
of
are
it.
running
We
out
are
of
running
time.
out
So
of
let's
time. So
wrap our
let's wrap our
discussions.
discussion.
Overall, we can
Overall,
know
we can
that
know
all bad
that all
action
bad
will
action
eventually
will
will
eventually
be
will be
against the
against the
responsible party.
responsible
In
party.
addition,
In
we
addition,
also
we
can get a
also can
know
get a know,
sorry,
get
we can
sorry,
also get a
can
new
also get a
knowledge
new
of
knowledge
technical
of
problem
technical problem
where we can
where we
how
can how
it happened,
it
how the
happened,
patient
how the
feel about
patient
it,
feel about
and
it,
so on.
and so on.
Finally, our
Finally,
counselor
our
has
counselor has
explains
explained
what the
what
victim
the
will
victim
feel
will
when
feel
being as
when
bullied
being bullied,
and how the
and how
victim
the
can
victim
overcome
can
it.
overcome it.
My advice
My
to all of
advice to
you
all
and
of
also
you
to
and also
myself,
to myself,
we need to
we
learn
need
a
to
little
learn a little
patience so
lesson
as
so
not
as
to
not
do
to do
this bad
this
thing to
bad
others.
thing to
Have
others,
your
have
mercies
your
and
mercy,
be
and be
considerate to our
considerate
fellow
to our
human
fellow
beings.
human beings.
Thank you.
Thank you,
Thank you and have a
thank
nice
you, and
day,
have a
everyone.
nice day, everyone.
Assalamualaikum.
Assalamualaikum.
Okay,
Okay,
Waalaikumsalam.
Waalaikumsalam.
So you don't
So
open
you
for
don't
Q&A
open
for
for
the
Q&A for the
participants now?
Yeah,
participants?
we
Yeah,
are
we
open.
are
If there
open.
a
If there
question,
are a
you
question,
can check
you can check
at the chat
at
box, yeah?
the chat box, yeah?
Any question?
Any question?
Okay, so my
Okay, so the
questions, I have one
questions, I have
question,
one
which
question,
is,
which is,
so some of the
so some of
victim
the
must
victim
be
must
afraid
be
to report
afraid to
what
report
happened to
what
them,
happened to them,
particularly for
particularly
management
for
as well as
management as well
counselor,
as counselor.
because they
Okay,
are
because
afraid
they are
or
afraid
worried that
or worried
others
that
worker
others
may
may
know about the
know
problem.
about the
So do you
problem.
have
So do
any
you have any
strategies for
strategies for
reporting and
reporting
addressing
and
this
addressing
disability
this
harassment
disability
so that
harassment
the others
so that the
workers
others workers
don't know about
you know
the
about
case
the
happen in the
case happen
factories?
in the factories?
Okay.
Okay.
Okay, about this
Okay, about
problem.
this problem,
We
we
bila
bila
dorang
orang
complain,
komplain,
kita takkan bagi
kita
tahu
akan bagi
nama
tahu
yang
nama
orang
yang
yang
orang
complain
yang
tu.
komplain tu.
So nanti
So
kira
nanti kira
orang yang buat
orang yang
masalah tu
buat masalah tu
takkan
takkan
tahulah siapa
tahu siapa
yang complain tu
yang
lah.
komplain tu lah.
So jadi
So
selamatlah
jadi
dekat
selamat
mangsa tu.
dekat mangsa tu.
Okay, thank you,
Okay,
Miss
thank
Siti.
you.
Okay, thank you,
Okay,
madam.
thank you, madam.
Thank you, madam.
Thank you, madam.
Thank you, everyone.
Thank you, madam.
Thank you, madam.